Good afternoon, everyone. I'm Irvin Schorsch, the founder and CEO of Pennsylvania Capital Management. We're happy to sponsor this program, and we hope you've enjoyed the emails and correspondence we've sent your way prior to this webinar. This is a very important one, especially for those of you that are in your early 60s, as this is a decision that is essentially for those people that are 65 years of age and older. And my colleague Andrew Randisi will be filling you in on the do's and don'ts and all the nuances of Medicare so that you can make a smart decision when it's relevant for you. We think that Medicare is a tool, like your pension, like your other assets, and this is something that you want to integrate into your planning for your future. With that, I will turn this over to my colleague and certified financial planner, Andrew Randisi.
Well, thank you, Irvin. I'd say hello, everyone. Happy to be here and give a little bit of a presentation about Medicare. So let's get started, and we'll go right into the presentation right now. So let's start, everyone, for Medicare, what to know before you enroll. So let's get started. Getting started with Medicare. First, let's start off and say, what is Medicare? Medicare is health insurance for individuals that typically are age 65 and older in the United States. Eligibility is typically going to start, or what's called a special enrollment period, 3 months before an individual turns 65, the month of their 65th birthday, and then the following 3 months after would be that original 7th month special enrollment period for individuals to sign up for Medicare. Individuals are also eligible for Medicare if they're not 65, but also have any one of the following 3 conditions. That'd be a disabled person, that they're receiving Social Security disability benefits. You have end-stage renal disease or kidney failure, or Lou Gehrig's disease, ALS. Now, how do we sign up for Medicare? Signing up for Medicare, there's a couple different methods on how we can go about doing it. The first, that is usually pretty much that's fairly straightforward and pretty easy for clients of ours at PC that we've worked with, and I've even helped with as well, is signing up online. It's the fastest and easiest way to go about to getting any financial help you need. Often what will happen is you'll want to create a mysocialsecurity.gov account first, and from there you can do many different things. You can sign up for Medicare. You can also look at what your Social Security retirement or Social Security disability benefit would be, as well as you can apply for all of those benefits as well when the time comes. You can go the more traditional route and call them. Calling them, I typically don't always like to recommend, because if they do keep you on the phone for about 45 minutes, it can be a little bit onerous. Once they get you on the phone, they'll right away want to then set up a phone call appointment with a representative. That may take, scheduling-wise, another week or two. Or even sometimes a month, depending on how backlogged Social Security is, and they're always backlogged. You can also go to the office directly. That's also something I don't typically recommend for clients and prospects to do as well, because there's usually going to be a very, very long line. It feels like you're at a deli. One of our clients recently went. She camped out there like she was waiting for Taylor Swift tickets. That's how many people were there at 7 a.m. when they opened. Online, especially if you're comfortable with online, with the mysocialsecurity.gov account, is usually the best way to go about signing up for Medicare. Typically, after you've signed up, gone through the application online or by phone or in person, you'll get your Medicare card about 2 weeks in the mail. That's hopefully if the mail is on time. Sometimes that can be a little bit longer. It can maybe be stretching about a month or so, but eventually you'll get your Medicare Part A and your Medicare Part B card. Once those 2 cards you've gotten, you now can then sign up for either your Medigap and prescription Part D drug, or your Medicare Advantage, or what's also called Part C. You can do this on your own, which is totally fine. And you can research comparable policies. We have a little hyperlink below. And right on Medicare's website, you can type in you can go by your zip code. They ask for a little bit information about your age, with typically your date of birth. You can also plug in any type of medicines that you take, or your doctors, and be able to match out which plan best fits your needs. Oftentimes, what might be easier if you kind of get stuck, because there's a lot of stuff that they throw at you on the Medicare or .gov website, you can work with an insurance broker. I'd say, for example, at PCM, as part of our PCM professional network, we have two health insurance brokers that help clients either with signing up for a health insurance plan, if you were like say needing Obamacare, or if you're ready to sign up for Medicare, they're happy to help with Medicare as well too. And then once you're on Medicare, every year there's an open enrollment. And open enrollment is from October 15th to December 7th of every year. So if you need to make a change for the following year, for example, you want a better Medigap policy that's going to cover those Medicare excess charges, or one of your prescription medicines that you were just put on is not really covered, or you have a high out of pocket and want to change your drug plan, you can change your drug plan for the following year. Now, let's go through a little bit of the parts and mechanics of Medicare. Part A, this is going to feel like alphabet soup a little bit. Part A is going to be your hospital insurance. This is going to help cover inpatient care and going to the hospital, skilled nursing care facilities, hospice care, and home health care. Then you have what's called Part B for your medical insurance. This is going to be pretty much almost everything else, going to the doctor, the healthcare specialist or other providers, outpatient care, home health care is also under here as well too, durable medical equipment like a walker, a wheelchair, a cane, and then some preventative services, vaccines, yearly screenings. Then there's Part D, which is the drug coverage. This is going to cover the cost of your prescription medicines, including many shots or vaccines. If you go to the pharmacy for that flu shot, COVID shot, RSV shot, it's where you're going to present your drug. You're going to present your Medicare card when you go to your local CVS, Walgreens, or Rite Aid. You can join a Medicare drug plan. One of two ways you can get the coverage. One would be purchasing the Part D through original Medicare, if you go with the Medigap route, or you get the drug coverage included by signing up for a Medicare or Advantage plan, or which is also called Part C. These Medicare Advantage plans that offer the drug coverage are typically run by private health insurance companies that follow the rules set by Medicare. Now that we've gone through the parts, wanted to see how much this would typically cost for the average person per year. So Part A, which would be that hospital insurance, is going to be free. Part B, the Medicare insurance, right now for 2023 is $164.90 per month. And this is subject based on income. There is, and we'll get to in a minute, an income. What Medicare does is depending upon how your income is from 2 years ago, they can charge you a surcharge above the Medicare base premium, which for 2023 would be $164.90. That's this little fancy acronym here called IRMA, which stands for the Income Related Monthly Adjustment Amount. I know it's kind of a bit of a mouthful. Wanted to also give there for next year, typically just like with Social Security cost of living adjustment, Medicare usually goes up as well. That's why it sometimes eats your raise, which is often very frustrating for Social Security recipients. Next year, Medicare Part B is going to be increasing about $10 to $174.70 a month before any IRMA month or related adjustments. Part B for your medical insurance does have a deductible. So very similar to what some traditional health insurance plans might have, or if you have a high deductible healthcare plan, you're fairly used to this. You may have some out of pocket before the insurance fully kicks in, but the deductible with Medicare is quite reasonable. It's $226 in 2023. Next year goes up a little bit, $14 to $240. When you're signing up, you want to be for Medicare Parts A and B. You want to be mindful when you're signing up for Part B. You want to either sign up when you're first eligible, because you may face a 10% penalty for each year you didn't sign up for Part B. Now, if you're covered under qualifying health insurance through your employer or a spouse's employer, which we'll get to a little bit later, that's okay because you're exempt from that. But when you are 65 and you need to sign up for Medicare, sign up when you can to avoid that penalty. The Part D, the drug insurance, these premiums are going to vary, and it's going to based on the company that you select. Often with clients, there's a variety of companies from either a WellCare to an AARP, United Healthcare, Aetna, Humana, many different companies, very different flavors you can choose. Express Scripts is another one. And depending upon what you need, these can be anywhere from 0 to 50 cents to 50, 60, $100 a month, depending upon what your needs are and the type of medications you take. Part D, if you go the traditional Medicare route and get the Medigap with the drug coverage, you're going to want to sign up for the drug coverage as well, because if you don't sign up for Part D immediately, you will face an extra 1% penalty for each month you go without Part D. And I have a very good kind of anecdotal story about this from my grandfather. In 2010, he was changing his Part D. He decided to go without it. Man was a bit of a cheapskate. So he decided to not need it. He didn't take that much medicines. Fast forward to 2019, when it was time, he was now put on medicines that were going to be costly and needed the Part D insurance. When my father and I did sign him up for the Part D, his drug coverage, the underlying Part D, it was $150 a month he wound up paying for his prescription drug insurance. 100 of that was the premium. Of that 150, 100 was the premium, 50 was the penalty, because he went basically almost 10 years without the drug coverage. So it does add up. Even if you don't think you need it because you take basically nothing, get the 50-cent or even the free plan just to avoid that penalty. These premiums for the drug insurance for Part D are also subject to IRMA, which we'll get to in a minute. I think that's actually the next slide. Medigap premiums. So this would be the supplement, because your traditional Medicare, which would be the A and B, this covers 80% of the healthcare costs. The Medigap covers the gap, the remaining 20%. These premiums vary based on age, your geographical area by zip code, and other factors. Medicare Advantage plans, which would be the all-in-one, the Part C. This depends on several factors as well. Sometimes it's even free, depending upon the plan you select from a private insurance company. Next, we're going to go a little bit more in depth on IRMA. So for IRMA, that income-related monthly adjustment, as I had mentioned before, IRMA looks at when they decide what your related adjustment would be, they're looking at your tax return filed from 2 years prior. So for example, in 2023, we're looking at what your income would have been in 2021. So for example, to have that base premium, which would be approximately $165 for the Part B, if you're an individual income tax filer, if your income in 2021 was $97,000 or less, you would just pay the base premium. For a married couple filing jointly, we double that, $194,000. Oftentimes this pops up with meetings. We see clients that say, Andrew, I'm getting this IRMA. It's just eating up the paycheck, or my Social Security check, or I get this. It is, I know, we look at it, it can be a bit onerous especially if you're a very high income old person that's over 65. It can be up to $560 a month can be your IRMA, but you're still going to come out way significantly cheaper than if you had to pay out of pocket for a traditional health insurance plan, which could cost, upwards of $1,000 to $1,500 per month, depending upon how much coverage you wanted. One thing to note about IRMA, though, is you can challenge IRMA. You can contact Medicare and let them know if you had a life-changing event that had happened. They can go back and reevaluate what you were going to pay for your IRMA premium and even reduce it or completely eliminate it. Oftentimes we see this for clients would be client retired at 65, goes on Medicare, was making in this example, $750,000 a year, the Medicare is going to want to charge you the highest. Because you've retired, your wage income is, you're not earning any wage income anymore. What you can present to Medicare is proof, typically it'd either be your tax return or your letter from HR from your former employer that you're retired. They'll evaluate that and they can adjust this back. If your income is going to be significantly lower going forward, you won't have to get hit with that onerous IRMA payment. And that goes for parts A and part D. Now, I had mentioned before, when you, after signing up for Medicare, you do have a decision to make. You can either go the traditional route or the Medicare Advantage route. This is the decision. It's two roads that split. We get home to a fork in the road with two paths to take. The traditional route is the Medigap, is traditional Medicare, original Medicare with the Medigap. So you get parts A and B, and then also you're going to want to get that drug plan too. The one thing that we like very much so about going the traditional route with the Medigap and the Part D, the drug insurance, is pretty much you can go to any doctor or hospital that takes Medicare in the United States. It's kind of like, I would say, having the equivalent of if you had a PPO plan on you for a regular health insurance. Pretty much anywhere that takes Medicare, they're going to take your Medigap. Also, the great thing about this is it's going to be a little bit more comprehensive. So this is going to pick up that 20% coinsurance, and also that I often like to call it's like Cadillac healthcare coverage. It's better intended if you have severe health problems, or if you want to have the maximum coverage. The other route that you can choose is the Medicare Advantage route, which is called Part C. This is going to be, again, as I had mentioned before, it's a Medicare approved plan that's going to come from a private insurance company that bundles everything together, A, B, and D. Oftentimes, you'll see the same companies that are offering you the Medigap, they also have their hand in the Medicare Advantage too, and they're going to try and push the Medicare Advantage on you over the Medigap. This is often when you go on MeTV, you'll see Joe Montana selling health insurance. It's a Medicare Advantage plan. Medicare Advantage does have some drawbacks. In most cases, you'll need to use the doctors that are in your plan's network. If you're okay and your doctor falls inside that network, that's fine. But if you wanted to use a doctor that was out of the network, you'd not be covered. The policy wouldn't pay for it. The plans do often offer some extra benefits that original Medicare doesn't offer, like vision, hearing, dental services. I know sometimes they offer silver sneakers, like a gym membership. It's good to have. Most of the time, though, often we'll see with clients say, my dentist, my eye doctor, they don't take it, because we have a lot of clients with dentists that they don't even take regular dental insurance, let alone would take Medicare. Out-of-pocket costs can be a little bit higher than going on the Medigap policy, but it is lower than not having a Medigap, because you can have an out-of-pocket that can be a couple $1,000. The Medicare Advantage plans, to me, I'd say how I would equate them. If I wanted to compare Medigap and Medicare Advantage, Medigap most to me resembles what would be a PPO health insurance plan for like regular health insurance for employees. And then the Medicare Advantage often to me feels like a high deductible healthcare plan, because it has they can have a lot higher out-of-pocket deductibles. It's mostly intended, though, I would say, for more healthier seniors. For the Medicare Advantage route, or if you're comfortable with the network of docs that you have, it's fine too. It's just not as comprehensive as the Medigap. Now, with the Medigap has many different flavors. It's almost like Baskin Robbins. There's 10 different Medigap supplement plans that you can choose from. They go from A to N. Now, I'd say we kind of wanted to put up a chart for you all to kind of look at them. So for Medigap, it's going to have your part. The majority of them cover 100% your Part A, which would be the hospital insurance. The Part B, which would be the Part B coinsurance. It includes 3 pints of blood, Part A hospice insurance, hospice care, skilled nursing care, Medicare Part A deductible is covered in 100% for most of them. You're going to see a few of these that are going to strike you looking on the screen. There's two plans with an asterisk here. There's this F plan, which covers the deductible 100%. It also covers the excess charge, the Medicare excess charges 100% as well. You might be saying to myself, Andrew, this looks like to be the best choice, the best Medigap supplement to pick. It is. Unfortunately, it's no longer accepting new applicants. Why that is such is because back in 2015, when Congress was repassing new legislation, they wanted to make it that new Medicare applicants would have a little bit more skin in the game, because this plan basically covers everything from A to Z, including that $226 deductible that I had mentioned for 2023. It goes up to $240 in next year in 2024. What they did was they closed this pool and made it so that you can't then phased it out so that by 2020, 65 individuals that were turning new freshly minted 65-year-olds by 2020. Once that they drew a line in the sand by 2020, if you turn 65 on or after 2020, you were no longer eligible to join Plan F. They also closed Plan C as well too, because that plan also covered the deductible 100%. So the next best plan to have, which would be the Plan G, which covers pretty much everything 100% except for that deductible. If you want to, Plan G can be. We often actually see now clients say, Andrew, when we spoke to your Medicare specialist from the PCM Professional Network, it often came out a little bit cheaper because I was already on F for many years, switching to G, because oftentimes the savings in between the two from the plan premium often is better than just by paying the out-of-pocket and still paying the out-of-pocket deductible. You still make out a little bit ahead, because since Plan F is closed, that pool of people is shrinking from either individuals passing away or people essentially jumping ship and going to the Plan G plan. If Plan G is still a little bit expensive for you, the next best one would be going for the Plan N, which doesn't cover the Medicare excess charges. Now, on a final note, what we wanted to cover would be what happens. We often get this, Andrew, Irvin, Leslie, I'm still working past 65. What do I do? And I'd say, like with our profession, one thing we usually always say to answer a question is it's going to depend. It depends. And it's going to depend where you're getting your health insurance and also the number of employees that your company has based on whether you or your spouse work. Generally, I would say if you work for a large company, a very, very large company, couple hundred employees, 1,000 employees. If you have job-based health insurance coverage, either you or your spouse, you don't have to sign up for Medicare Part A or Part B while you or your spouse is still working. You can wait to sign up or your spouse when you either stop working, retirement, either you retire, your spouse retires, or you lose your health insurance, whichever comes first. If you're a self-employed person or you have health insurance that's not available to everyone at the company, you're going to want to ask your health insurance provider if your coverage is an employer group health plan coverage defined by the IRS. If it's not, and you're self-employed, you're going to want to sign up for Medicare when you turn 65 to avoid that Medicare Part B penalty and the D penalty that we mentioned before. If you work for a smaller firm, your employer has less than 20 employees, you might need to sign up for Medicare when you turn 65 so you don't have gaps in your job-based health insurance. Best to check with HR at your company. And then finally, we have Drawn Cobra, because oftentimes we'll see this with clients. They kind of line it up. If you retire at 63 and a half from your job, you get 18 months of Cobra that carries you right to 65. You should sign up if you're currently on Cobra and you're about to turn 65, sign up for Medicare when you turn 65 to avoid, gaps in coverage and that monthly Part B late enrollment period penalty. If you have Cobra before signing up, your Cobra will probably end once you sign up. That's kind of why I mentioned before that timing feature where we see 63 and a half, 18 months takes you right conveniently to 65 to go right onto Medicare. With that now, I'd say we've kind of, that was my last slide. What I'd like to do now would be open it up for Q&A and answer any questions that our attendees might have.
When you sign up, do they ask me health insurance questions to determine how much I pay for Medigap coverage? Does my health status play into it?
So I'd say if you're signing up for Medigap and you're signing up, if you go the traditional route with the Medigap and you are signing up at 65, you have guaranteed issue. So you can have everything. You could be like Humpty Dumpty completely falling apart. They have to take you and issue you a policy. But in terms of the premium, the premium can vary depending upon male or female, if you smoke or you don't smoke, and sometimes even where in your geographical area.
But no health questions, not specific about...
They will, it's a guaranteed issue. They have to accept you. So you could have disease XYZ, they'll take you. They might ask you if you smoke or you don't. They're going to ask you smoke or you don't smoke.
What about, I know you said it's an important decision between the Advantage plan or the Medigap plan. Once you pick Advantage or Medigap, can you change it after that, or are you stuck?
You can switch, but it can be quite onerous to switch. Because what happens is, let's say you start with, if you have Medigap and you go to Medicare Advantage, it's not too much of a problem. The problem is, where it can become a bit hairy is if you start out with the Medicare Advantage and then you want to switch to the Medigap, because what's happened is that guaranteed issue period has ended, in which the insurance company can't accept you, has to accept you no matter what is going wrong, no matter what health condition you might have. If you come, let's say you start with Medicare Advantage, you come down with an illness that causes a lot of out-of-pocket medical expense, you want to switch to the Medigap, the insurance company that's providing the Medigap, they can either say, okay, we'll allow you to come on, but you'll have a pre-existing condition waiting period before we'll start to pay. Or if it's too catastrophic, it may be a crazy high premium, or they just turn you down altogether.
Okay, so it really is an important decision to make when you're
signing. That situation happened with my grandmother because she started out on a Medicare Advantage plan. This was many years ago. She had renal failure. And when it went time to try and changing her to Medigap, it was very, very difficult, and the premium was absolutely astronomical. Can
I use Medicare while traveling out of state or out of the country?
Yes, you can. There is from, I'd say, the slideshow, I believe, yes, there is foreign travel exchange. You can go anywhere, I'd say, with the Medigap, especially. You can go pretty much everywhere and anywhere in the continental 48, Hawaii and Alaska. There is foreign travel exchange up to plan limits. The Medicare Advantage, though, you may have to with an out of network. You might be out of network though.
Right, because that one's more regional based, like an in-network providers.
Yes.
We've got another one about HSA funds. Can I use HSA funds to pay premiums?
Yes, starting at after 65, the great thing with the Medicare premiums is you can use those to pay for the Medicare premiums, any out-of-pocket medical costs, prescription drug costs that you have. And one great thing with HSAs and kind of coordinating them with Medicare is once you've turned 65, with the great thing about the HSA, you don't have to necessarily use it for just out-of-pocket healthcare costs anymore. It kind of can turn into like a quasi pre-tax IRA. You can use it for other expenses that are non-healthcare, It's just that you have to pay tax on the earnings. But you can use it you can use it tax-free to pay your Medicare insurance premiums and the Medigap.
I have another one. Andrew, would you comment for our viewers today, what does their taking Social Security have to do with Medicare, if anything?
I'd say with taking Social Security with Medicare, oftentimes what we see is we have you can elect to have if you're not taking Social Security, Medicare will send you a bill for the premiums. You can pay it by check, credit card on Medicare.gov's website, or they'll send you a bill in the mail. With coordinating it with Social Security benefits, when you start to take them, you can have those Part B premiums deducted from the benefit. So each month, if we'll say you get $2,500 a month for Social Security, if you take it at full retirement age and you're paying that $165 for Part B, they'll deduct the $165 from your $2,500 check, and you'll get the net amount ACH deposited to your bank account each month.
How do you get coverage? How do you ensure that your coverage is right for you and your personal circumstances?
Got it. That's a very good question. And that's where I'd say sometimes it's best to speak with a Medicare insurance specialist. They're oftentimes called Medicare insurance brokers, because what that individual the individual group would do, and we have two of them that we work with that are wonderful at Pennsylvania Capital Management as part of our professional network. They will they will ask you for your list of doctors, all the specialists that you see, all the medications that you have that you get from the pharmacy, down to the quantity and the dosage. And they'll be able to input all of that data in and map out which plan, which Medigap would be best, also which Part D would be best. So you're getting the maximization to fit your needs. You can do that also on the Medicare.gov website, but it can be quite confusing. It can be a little bit confusing.
Do Medicare brokers charge you? How do they get paid?
Typically, they're not going to charge you. How they're going to get paid, it'd be like I would say it often resembles when you buy like your property and casualty. That broker is going to get paid through writing the policy. Oftentimes with the broker, it's not just one company. They have a vast network of they have a vast amount of companies that they're working with. So 1 year, I'd say, and 1 year it could screen out that you're working with Aetna for your drug insurance for Part D. The next year it could be WellCare. Then the following year it could be United Healthcare, or it could be we often see clients get it through USAA. Is another one that also offers health insurance, offers the Medigap insurance as well too. And
we're in enrollment period right now. So is this the time if you want to make changes, you have to do it in the enrollment period? This is the only time of year?
Correct. So if you are already on Medicare, open enrollment just opened October 15th. It goes through December 7th. This would be the time to either call your insurance company, your private insurance company, to make sure you have the best plan. Call that broker, or you can start with your financial advisor first to see if the coverage is right to fitting your needs. If you wait through December 7th, you have to wait again until the following open enrollment.
Following October. Okay.
Yeah, they give you plenty of time though. It's like I think it's 6 weeks.
I've got one for you here. For our viewers who want to plan well and they have their fiduciary advisor, or they want to go find one, how important is Medicare and Social Security to the process of planning your golden years?
I'd say it's very important and wanting to plan, because I'd say for a lot of retirees, Social Security is going to be a good majority of, we'll call it your post-retirement income. I'd say for most, it could be anywhere from 30 to maybe even 60%. You want to make sure you're maximizing those Social Security benefits. That often is a decision that has to be kind of thought of. You can look at it with how much you've earned, what your earnings have been That can be want to look at longevity of the family, what your income needs are right now based on how much of a nest egg that you have. That'd be we'll call it the financial side of it. And then the health side and wealth is so much entwined with health and wealth are so much entwined together. Making sure you have the right Medigap coverage, the right Medicare healthcare coverage in retirement. That way, if you do have healthcare problems, a lot of that's covered. You're not facing a lot of out-of-pocket healthcare expenses, which could put a burden on your retirement nest egg.
I've got one more here that's asking about the penalties if you don't enroll. How does that work? Because then on another slide you mentioned working past 65. So do you have to notify Social Security that you're not taking it because you have other coverage, or how do you do that and not get penalized?
So if you are working for, I'd say it's always first if you're about to turn 65 and you are working for a very large employer, check with HR first if you have to sign up for Medicare or not. Because you can avoid the penalty if you're working for a very large company. It was above, I think the slide said above 20 employees. You can stay on your regular healthcare insurance. You can stay on your spouse's healthcare insurance. Let's say, for example, we have a client, his spouse is in her early 70s. She's still covered under his health insurance. She's not on Medicare. She's 73 because the husband still works and he's 66. He's going to be retiring next year, at the end of next year. When he retires, they're both going to be joining Medicare. Because she had qualifying health care insurance from 65 now to 70, she won't have that Medicare, she won't have that Part B or D penalties.
So does the insurance company that you're on notify Medicare that, hey, I've got coverage, no need to penalize?
You don't need to necessarily notify them. What happens would be if you're past 65, you'll need to be able to provide proof that you are on qualifying health care insurance.
That is the last question on my list here.
Well, look, we want to thank all of you for coming today. We hope that you have absorbed this information and you can use it for your best interest as you decide how to handle your Medicare challenge and questions and make the right choices. Andrew gave us a lot of very useful information here today. We welcome you to follow up with us. You could always send an email question to Leslie at PCM Advisors, since she hosted us today. You could also call us at 215-881-7700. We'd be happy to respond to your planning questions that you have as you approach your retirement or your golden years and stay active. Either way, we want to help you make the right decisions. Thanks for joining us today.